The Knowledgeable Provider podcast is educational, entertaining, and not the same as medical training. The information presented here should not be used by anyone to diagnose or treat any medical condition in themselves or others. If you need medical advice, go see your own knowledgeable medical provider. Opinions expressed on the podcast are solely those of the people expressing them and are not necessarily representative of any other entities. Other than lunches at the office, I do not receive any sort of compensation from pharmaceutical or medical device companies, and I have no other relevant financial disclosures. It's all fun and games until someone gets sued, am I right? Okay, on with the show. Hey, welcome back to Knowledgeable Provider. I'm your host, Jody Marks. We'll talk about a new medication today that I just became aware of. We got the spiel from the rep for the first time at our office earlier this week, and it's an interesting medication. The brand name is Auvelity, Auvelity. This is a combination of dextromethorphan and bupropion. Yes, that dextromethorphan, the cough medicine that's in every over-the-counter cough cold product on the market. And yes, that bupropion, brand name Wellbutrin, the antidepressant that works on dopamine and norepinephrine. I will say it pisses me off a little bit when pharmaceutical companies take two old medicines and stick them together and call them a new medicine, for the simple fact that I know that means that it's going to now be expensive and a lot of people are not going to be able to get it, which just sort of rubs you the wrong way. We went through this with brand name Duexis, which is where they took ibuprofen and stuck it together with famotidine and called it Duexis. And it worked great and people loved it, and it really, really helped a lot of people with arthritis. And they had this great deal with some pharmacy in Florida where people could get it for nothing. And they brought us samples and it was just lovely for everybody. Well, then they quit doing all that and it went generic, which typically means it's affordable. But in that case, it meant that now the special deals are off. Nobody can get it from the special pharmacy and still nobody's insurance was covering it. So it became unaffordable, unattainable for a lot of people. And obviously you could tell people to just take ibuprofen and famotidine together, but people swore up and down that it was not the same. There was something about it being together like that was different. And maybe there is. I don't know. I'm not a chemist, but I feel like we're going to be in a similar situation with this Auvelity. I would say not as many people are going to be affected by a medication for depression as would be affected by a medication for arthritis. But I guess all of that's neither here nor there. So this medication is a novel antidepressant because of its mechanism. When we think of antidepressants, of course, we think about serotonin, dopamine, norepinephrine, and the different combinations of reuptake inhibitors of those neurotransmitters. This one ultimately works on glutamate, which is an excitatory neurotransmitter. It does that by antagonizing the NMDA receptor, that's N-methyl D-aspartate receptor, and it also works on the sigma-1 receptor. I'll post a couple of very interesting articles about the history and the specific physiology of those receptors. Initially, that sigma-1 receptor was just thought to be part of the NMDA receptor. It took a long time for anybody to realize that that was a separate thing. So I guess I'm not going to say guilty, but I will confess that I've not done a deep dive like this on every medication I ever prescribe. I'm sort of a bottom line guy. Like, what is it for? What are the big contraindications? What are the things I need to stay away from? How do I do this safely and how do I use it effectively? That's kind of where I am as a clinician, as a prescriber. So I'm sure this is all probably true to some degree for every medication that we use. But just looking back at the history of how all this came about, the basic research on these receptors was started in the 80s, which, much to my chagrin, is about 40 years ago. And it's really interesting to see the process of how all that starts as just basic research that ultimately becomes something useful that you can give to a patient. It's pretty mind-blowing to think about all the time and work that goes into these things that we just sort of take for granted in clinical practice. So anyway, I thought the NMDA receptor sounded kind of familiar. This is a common site of action of a lot of street drugs. So PCP, ketamine, methoxetamine, MXE, which is similar to ketamine, also nitrous oxide and alcohol affect this receptor. So this is a pretty interesting example of a pharmaceutical company making a medication that does the same thing that a lot of substances that people would use to self-medicate for depression do. Of course, ketamine itself is being given as a treatment for depression, anxiety. I have one patient that's doing this very successfully, as far as I can tell. That's a very interesting overlap there of recreational drugs effects now being turned into legitimate legal pharmaceutical drug effects. And dextromethorphan as we know, is commonly available, and people do abuse that. Is that what robo-tripping is? Let me look that up. I love that term, robo-tripping. Yes, that is the slang term for using dextromethorphan to get high, robo-tripping. So what we have here is a legal robo-trip for our patients with depression. Normally, the dextromethorphan is metabolized pretty quickly, so just using that by itself, it would be difficult to achieve therapeutic levels with it as an oral medication. Bupropion is an inhibitor of the CYP2D6 enzyme that breaks down the dextromethorphan. When the company rep presented this to us, he highlighted that. He said, the reason this works is because the bupropion makes it possible for the dextromethorphan to stick around longer. So that was accurate. The dextromethorphan actually does act on serotonin as well through that other receptor, the sigma-1 receptor. And then, of course, with the bupropion component, you're getting its mechanism of increasing levels of dopamine and norepinephrine. So it sounds like really you're getting the effects of a tricyclic antidepressant working on all three, serotonin, dopamine, norepinephrine, with the addition of increasing the level of glutamate. So it's a little bit of new and a little bit of old. The medication was approved by the FDA in 2022 for treatment of major depressive disorder in adults. One tablet contains 45 milligrams of dextromethorphan and 105 milligrams of bupropion. You start with one tablet daily for 3 days, and then you can go up to one tablet twice a day. So that would give you 90 of dextromethorphan and 210 of bupropion. It'll be interesting to see. Let's look at Mucinex DM. A lot of our patients take that for cough, cold kind of thing. Just for comparison, it looks like a tablet of Mucinex DM contains 60 milligrams of dextromethorphan. And I think it's the same form, dextromethorphan hydrobromide. That's what's on the label of both the Mucinex DM and the Auvelity. So as far as I can tell, it's the same form of dextromethorphan you get in the over-the-counter cough cold products. You actually get a little bit more in the over-the-counter products, it looks like. And then typically with bupropion, we're doing either 150 or 300 milligrams when we're writing that by itself. So the Auvelity tablet has a bit less bupropion in it than we're typically using when we're using it by itself. So my brain here is already jumping to, could I just put somebody on bupropion and then tell them to take dextromethorphan with it every day, just assuming that they're not going to be able to afford this new brand name medication? Now, this is just me, one individual person talking here, my opinion. I think you probably could. I think that might be worth a try. Please remember the disclaimer at the front of this podcast that says this is not to be used as medical advice, especially if you're a non-medical professional listening to this. I am not telling you to go do that. I wonder if cough medicine works better if you're already taking bupropion. Contraindications of the Auvelity: seizure disorder, people with bulimia or anorexia, people who are abruptly stopping their use of alcohol, benzodiazepines, barbiturates, or antiepileptic drugs, people who have stopped using an MAOI within 14 days. You want to pay attention to the blood pressure. Of course, we know the cough cold medicines like dextromethorphan can raise blood pressure. With all antidepressants, you want to be careful with seizure risk. If people have bipolar, there's a risk of it triggering mania. With a lot of antidepressants, you have to worry about angle closure glaucoma, so untreated glaucoma you'd want to know about. Of course, like every antidepressant, it may contribute to serotonin syndrome. Not good to take it while you're pregnant. This could cause fetal harm. Most common adverse reactions: dizziness, headache, diarrhea, somnolence, dry mouth, sexual dysfunction, and hyperhidrosis. So yeah, very cool. Got something new on the horizon. I can definitely see trying this with people who have already tried all of the antidepressants and never seem to get better. It doesn't actually have an indication for refractory depression, but that may be a good situation to try it in. As always, I will post links to the articles I used as references. If you have some time, check out these big, long articles about the physiology of these specific receptors and how that came about. That's really a super interesting thing that's not always on my radar. I should say this is not sponsored by a pharmaceutical company. It could be. Big Pharma, send me some money. I'll be your shill if the price is right. But no, this is not a sponsored advertisement for this medication. Just me talking. If you have anything to add, feel free to get in touch. Or if you have any experience with this medication that would be helpful for other people to know, please get in touch. Thank you so much for listening. Special thanks to our Patreon supporters. I hope that everyone has a great week, and I will talk to you later. All right, that does it for this episode of Knowledgeable Provider. Very special thank you to our Patreon supporters:
If you would like to help support the show for just $5 a month, please head over to patreon.com/knowledgeableprovider. If you're looking for more content, check out our YouTube channel and our Facebook page. Remember, all of those ratings, reviews, likes, follows, subscriptions, etc. really do help the show, so take a second and do those things to help me out. If you have a request for an episode topic or if you'd like to be a guest on the show, I'd love to hear from you. Email me anytime at thekppod@gmail.com. That's thekppod@gmail.com. Thanks so much for listening, and as always, stay safe, take care of yourself, and take care of your patients, in that order.